Hi, and welcome to What's Happening at Tri-City Medical Center. I'm Kellie Davis, and I'll be your host for this series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local hospital and provide you with information for a healthy lifestyle. With us is Dr. Adib, a board-certified OB-GYN practicing at Tri-City Medical Center after extensive training and experience abroad. She is here to talk about women's health and to answer questions about annual exams. Welcome, Dr. Adib.
Thank you so much, Kelly, and thanks for having me here.
The first thing I want to do, you have such a lovely name, and I didn't want to butcher it. Could you please say your full name for us?
Sure. I am Tanaz Ebrahimi Adib.
What a great name.
Thank you.
So, Dr. Adib, my mother used to tell me when we're talking about preventive care and gynecological visits, way back before I would even see one, she was telling me as a child some of her, what her information she had as a woman growing up in South Carolina. So I always had to take a little bit of a grain of salt with what she said, but she would say things like, pay attention to that area. Make sure that you don't wear underwear when you sleep at night so you can have it breathe. You know, wear socks on your feet to keep yourself warm. Are these just wives' tales, or is there something true to this kind of thing?
There is definitely some truth to that, Kelly. If women wear tight pantyhoses and tight pants at all times, then the area will be kept moist and warm at all times. And warm, moist environment is the best to invite yeast. So they're more prone to get yeast infections. So that's a very good idea indeed. So your mom was absolutely right.
Well, that's good to know. She certainly felt that she was right, so that's good. So how often, now gynecological visits, how often we as women should we be going?
At least yearly if there's no problem. But if there's any problem, the doctor will let the women know what is the time of the next visit.
And do women who are done with childbirth or have undergone a hysterectomy, and please for our audience let them know what a hysterectomy is, does that change for them?
Not really. I'm so glad you asked this question, Kelly. A lot of women think if they're done with childbirth or if they have removed their uterus, which is called in medical terminology a hysterectomy, they're done and they don't need any more annual exam. But it's absolutely not true. The first time to start with an OB-GYN visit is at least 21 years old, or at the first time that they become sexually active, whichever comes first. But they need to continue annual visits with GYN doctor, and there are different reasons to that. Number one, if someone has removed their uteruses and they don't have their cervix, maybe they don't need a pap smear in some specific cases, but they still need that annual breast exam and also annual pelvic exam. If someone grows a tumor in their ovary, which the most common age is 50 years old and up, there's no way they would know unless that tumor gains considerable size, and starting to treat that at that point would be a lot less successful. Also, women who are done with childbirth for the same reason, they definitely need to continue their visits for OB-GYN. A lot of ladies, I've had a lot of patients that went through menopause and for some reason, for a disease or underlying pathology, they bled a little bit. And they thought it's normal, or they told me, oh doctor, I got young again and I had another period. My neighbor said that's okay, but that might be the first sign of cancer. So we need to be very vigilant on that. So when I said yearly, that means that everything is good. There's no changes or no problems. But as soon as women notice any changes, any discharge, any unusual bleeding that is not supposed to be there, they need to definitely make an appointment and come to us.
Wow, that's definitely fascinating. And also with women who practice abstinence, for example, they should also be going, just because you're not having, this is not something just because you're having sex or not having sex. Is that true?
Very true, Kelly. Women who are abstinent or women who have sex with the same sex still need to do their annual visits because other things might be going on, as I said, in their tubes, in their ovaries, or in their breasts.
And women who already gone through menopause, what about those, that category as well?
Right. The common age to start getting cancers is about 50 years old on average, and that's around the time that women go into menopause. We know that pap smears are the best way to screen cervical cancers. So even though they're, of course, done with their childbirth, they still need to come yearly to the doctor to get their pap smears done and also to get a pelvic exam to check other organs beside their cervix.
So let's change gears just slightly, since we're talking about these visits, and a lot of women may come. Yes, they might have maybe I think called it STIs now, or I don't know if the proper, or STDs, and just checking up. But what about the women who might think that they're infertile, and what does that mean, infertility? What is that?
Very good question, Kelly. I've had ladies who came to me for different reasons, like pelvic pain, unusual bleeding, and they didn't have the courage, or they were embarrassed to tell me, hey doc, I'm trying to get pregnant for 3 years now and it's not happening. They just come to me for other reasons. But by definition, infertility is when people have unprotected sex for a year and pregnancy is not happening.
Okay. And is there an age range that a woman should be concerned about, you know, can I get pregnant, future pregnant?
Yeah, it's a known fact that after 35 years old, Kelly, the fertility levels or fertility capability reduces gradually. But in the modern world, since a lot of women are into getting professionals first and they focus on their career first, I've had a lot of ladies who started thinking about their family or childbearing in their early 40s, and it's still doable if they come to a doctor beforehand and make sure they're getting checked and they get whatever that is needed beforehand. Also, the 1 year time that I said, that applies to people that are below 35 years old. If a woman is above 35 and they tried for 6 months and it did not happen because the clock has already started ticking for them, they need to come to GYN.
We have about a minute. What can be done for infertility? I hear about this in vitro fertilization. What is that, the only thing? Is there other things?
Yeah, actually a lot of doctors, as soon as they hear that from their patient, they automatically refer them to IVF, which is tens of thousands of dollars, which is normally not covered by insurance. Lots of invasive procedures and lots of hormones loads on women. But before doing that as a last resort, there are lots of things that can be done by the doctor, like a whole workup to find out the underlying reason. And sometimes the underlying reason is so simple that it can be corrected and the woman can conceive on her own.
Thank you, Dr. Adib. And if you want further information on women's health at Tri-City Medical Center, please visit tricitymed.org.